All right. Hello, everybody. Welcome back to another episode of Speech Therapy PD.com's YouTube site. I'm your host, Stephanie Michele Sweigart. I'm a licensed and practicing speech language pathologist. I'm in the schools out here in California, and my pronouns are she, her. Today, we are diving into an incredibly important topic, one that affects many families around the world, and this is the treatment of selective mutism in the pediatric population. Real quick, before we introduce our guests, make sure you hit that subscribe button and ring the notification bell so you won't miss any of the valuable insights that we bring to you on various episodes where we're talking about speech, language, and hearing topics. We're all about spreading the wisdom, the knowledge, and really fostering your understanding here at SpeechTherapyPD.com's YouTube channel. So join our community if you have not already. All right, back to our focus today. This is the main focus, selective mutism. And this is not just a shyness or a reluctance to speak. This is a complex condition that can greatly impact a child's ability to communicate in certain situations. And the good news is that there are effective treatments and strategies that can help children really overcome the challenges and find their voice. So we have today none other than our renowned guest, Dr. Joleen Fernald. She is an SLP, and she works with children who have a variety of communication disorders, and she specializes in the assessment and treatment of selective mutism, and she is the developer of the DIR-SM model. So welcome, Dr. Joleen.
Thank you so very much for having me. I'm super excited to be here.
Absolutely. Thank you for coming and taking time to be with us. I know you're really busy. You wear a lot of hats. Maybe you could just share with us and the audience that's listening, maybe where you're coming from right now or any projects that you're involved in.
Sure, absolutely. So I am currently located in the Tampa Bay area of warm Florida, sunny Florida. I relocated here about 9 years ago from New England. So I was actually a New Hampshire child and spent the majority of my life up there and could not wait to get to where it was nice and warm down here in Florida with my husband and my daughters. My oldest daughter was diagnosed with SM when she was 3 years old. And so I was already a speech language pathologist. And when we were starting to search for supports and services for her, I was really surprised that everyone that I brought her to seemed to think that SLPs or myself should be the one who was the main provider of giving her the support. And that completely shocked me because in graduate school, I think I had about 20 minutes or so of, what is selective mutism? And truly, I thought that it was based on traumatic experiences. And I knew that wasn't the case for my daughter. So very long story short, I started seeking supports for her and ways to help remediate her selective mutism and basically put a program together that was ultimately successful. And because I was working in a pediatric outpatient clinic, I approached the director and said, hey, what do you think about us starting an assessment and treatment program, basically specifically for selective mutism? And we were the first multidisciplinary clinic. So we had OT, we had speech therapists, and we had licensed clinical social workers to support selective mutism. And that was back in 2006. So fast forward to today, where I've seen 2,000 plus kids with selective mutism. And I have a clinic in the Tampa Bay area. And then I also co-founded a school for kids with varying exceptionalities. And so that's what I spend most of my time doing. Yeah.
No kidding. What's the name of the school?
It's called Reconnections Education Center. And we do use the DIR floor time philosophy in our school. And so through that process, I ended up going back to school to get my PhD so that I could learn a little bit more about the mental health side of things. And then I'm an adjunct professor and I am a training leader for DIR floor time. So I do a little bit of a lot of things that I just have really great passions for. And I'm finally finishing up a book that if people have been listening to me, they've been hearing me talk about this book about selective mutism for quite some time, but it is finally in its limping to the finish line. I was hoping to get it out by October, but maybe by the end of the year. And so that's a really big, special celebration for me. I'm super excited to get that to everyone.
Oh my gosh. And we're going to come back to that at the end of this episode because I want to know the name of the book and make sure we have the link available for anybody that's interested in the show notes below. But wow, okay, so you were an SLP, but then it started off personal for you with your daughter being diagnosed at the age of 3, and then the strategies that you implemented were successful, and you wanted to create a program, and you got the green light in 2006 to do so, and over 2,000 lives have been affected. Probably more than that, right?
Probably more now.
It's a
Yes.
ripple of all the lives that you touch when we work with just one person. So that is truly an inspiring and incredible story. Thank you so much for sharing that with us.
Sure, absolutely.
Amazing. So lots of hats I heard that you're doing, and creating your own school and writing books. And but we also know that you are the author of a course on speechtherapypd.com called The Treatment of Selective Mutism in the Pediatric Population. And I'm super excited for this course. And I want everybody, our audience who's watching, to at least have some takeaways. And you're right, there are a lot of questions that come up around this topic. And I'm thinking that the best golden question we have for you really is, what would be 3 takeaways to support children diagnosed with selective mutism, to support them with becoming verbal and solidifying any constrictions that they may have developmentally?
Such a great question. I think what's really important is that we remember that SM is founded in anxiety, but it ultimately is also a communication disorder. So I hope that folks who are listening understand that anxiety ultimately impacts the child's ability to access their speech and language skills, that, when they're not feeling anxious, they're normally able to speak, typically in social situations and so on. But even though they may not struggle in those comfortable, confident areas, when they do get stressed and that anxiety kicks up, that's where we start to see it. And so it does impact things like our social skills, as well as our expressive communication. So I think it's important for SLPs to be empowered to know that they should have a seat at the table when assessing and supporting kids with selective mutism. And in many cases, I think, honestly, SLPs should be prepared to sit at the head of the table. We are really amazing at what we do and guiding and directing that communication. So I think that's probably the first, takeaway that I want to make sure that I'm sharing with SLPs. A second one would probably be that it's important to recognize that SM is a physiological response to that underlying anxiety. So it's not that the child's choosing not to talk. And to kind of take that even further, it's ultimately the body's misperception of danger, right? So what the body thinks is dangerous, even though it truly may not be dangerous, the brain tells the body that you are in danger. So that's causing any combination of what I call the 6 F words that we can say. And those are fight, flight, freeze, and fawn, fatigue, and flood. And so those all impact the child's communication success. And we need to be aware that this underlying cause may help us in reframing how we approach kids with SM, so that we can do it through a developmental lens, ultimately.
I'm familiar with fight, flight, freeze, but it's new that the fun, fatigue, and flood.
So fawn, F-A-W-N, fawn.
Oh, yep. I was hearing it wrong. I'm glad I clarified. Okay,
yes,
fawn.
Yes. And so, so fawning is when we sort of go along with the group or with a person so that we don't have that spotlight shown on us. And, we don't feel kind of uncomfortable with advocating, right? So instead, we just go along with whatever the other person's thinking. Fatigue obviously is getting, exhausted and being tired. And ultimately, a lot of kids hold it together all day long. So that fatigue is often shown more in the home environment. And then flood is really that flood of emotions. So that, emotional meltdown that you may get. And again, that happens a lot after school, more so than it's going to happen in the classroom setting or perhaps in the social setting and so on. So so being aware of those areas and understanding that through that lens, that's where the kids may be coming from. And the reason for that selective mutism, that it's not a choice, can help us approach them in a really supportive way. And then finally, my third kind of takeaway, I think, is that utilizing a bottom-up, inside-out intervention method, like the DIR selective mutism model that I created, will help us and help the child to create lasting internal changes that allow them to communicate confidently in various social experiences. So making sure we take time out to build that foundation of regulation and engagement while we're systematically and step-by-step progressing along a speaking hierarchy without extrinsic rewards is also going to lead to that lasting confidence.
I love that. Inside out, bottom up. That's easy to remember.
Yes.
I love that. And this is a part of the model of your the DIRSM. Yes.
Yes.
Fascinating. Wonderful. So, okay, let's talk about that, because you have that program. So people are listening to that and they're like, I want to know about that. I want to find out more about that. Or, you've mentioned your book now. Where would people go to find more information about this?
So there's a couple places they can certainly, yeah, absolutely. They can certainly go to the web, and my website is just joleenfernald.com. And I'm also on social media. On Instagram, it's Dr. Joe Selective Mutism SLP. On Facebook, I have a couple different pages on Facebook. One is just my general speech therapy page, which is my practice name, Joleen R. Fernald, Pediatric Therapy Services. And then there is actually a DIR selective mutism page. So if people are really interested specifically in the model and resources, they can go to that Facebook page to get those.
Oh, amazing. Okay. Lots of handles, lots of websites. We're going to post them all below this episode in the show notes so people can literally just click and go. So thank you for sharing all of your wisdom, all of your resources, your inspiring story, how you came to be where you are. I love all of that. I realized I pronounced your last name wrong when I introduced you, because it's Fernald.
No worries.
Fernald. So I want to make that clear that it is Dr. Joleen Fernald. Thank you so much for your time and being here with us today, and just your generosity of the information that you're sharing that is so very important in our field.
My pleasure. Thank you so much for having me.
Yes, absolutely. And before we close out, I just want to share, I've heard a lot of things that you said that resonated with me when I thought of mindfulness, compassion, and thinking about, you mentioned, anxiety and children with this anxiety, and how our thoughts are, causing emotions, and it's this kind of shut down response and fight, flight, freeze. All of it is like, okay, I'm thinking how some of these mindfulness tools could really help support kiddos. I was thinking about like just mindful breathing, right? For that calmness, just to encourage parents or caregivers, or even these children themselves, just to practice taking slow, deep breaths when we're facing those challenging situations, just to kind of center ourselves out of that fight, flight, freeze that our nervous system is in. And it can really help to empower the kiddos and to help with engagement and being more uncomfortable in that engagement. And then something else came up for me. I was like, oh, okay, well, sometimes, and I've noticed this, there can be a lot of negative self-talk, both outwardly and inwardly, that we can think even ourselves when we're stuck in these challenging times. So I was thinking it might be helpful to teach children who are having some of these struggles this compassionate self-talk, and reminding them that we can replace self-criticism with understanding and encouragement, and we can kind of reframe what we're saying to ourselves, and we can remember that it's okay to take our time, and everybody progresses at their own individual pace. We're not all going to be at the same place all the time. And I can just remind myself, you know what, I'm doing my best and I'm showing up, and I can keep improving with practice and repetition and, my team around me. Right. And the last thing I was thinking of is gratitude journaling, because I know that when sometimes we have a lot of these challenges that come up, our focus can kind of be stuck on that. Stuck on our challenges. And maybe if we could shift our focus out of challenges into things that we're grateful for, just reminding kiddos that, hey, at the end of the day, maybe we could just think about 3 things. And it could just be a thinking process. We don't have to say it out loud. You can just think to yourself and reflect on 3 things that you were grateful for today, just to kind of bring back, shifting that focus to positivity and maybe boosting their confidence and their overall well-being. So I just wanted to share some of that was coming up for me as I was thinking about the things that you were saying and how interrelated some of that is when we're talking about.
It overlaps beautifully.
Yes. So thank you so much. So, all right, everybody, to take a deeper dive into this topic, you definitely need to check out the course that we're talking about today, which is treatment of selective mutism in the pediatric population. And this is with presenter Dr. Joleen Fernald. And I'm saying that right this time. You can find that on speechtherapypd.com. And for other topics, when you subscribe to the site, you're going to get over 1 year access, or you're going to get 1 year access to over 900 live and on-demand courses that are available to, you're going to receive your ASHA CEUs. So you can scoop those up in your learning process, and you can pay a little extra and they will report those for you to ASHA. If you're new to speechtherapypd.com, you can consider checking out a free course. So that information is right below. So see below for details on taking a trial with the membership. If you found this video helpful, go ahead and give it a thumbs up. We also want to hear from you, so feel free to comment in the comment section below, and we'll see you back here next week as we're answering more of those golden questions that SLPs and SLPs are asking, and we're bringing in industry-leading experts like Dr. Joleen to give you the answers you need to boost your confidence and help you build your skill set.